Considerations on the use of hearing aids. Introduction to hearing in old age. Age-related hearing loss is the most common cause of hearing loss, affecting 40% of the population over age 65. It is caused by degeneration of the inner ear hair cells, influenced by genetic, environmental, social and other age-related diseases. It is characterized by a slowly evolving and progressive hearing loss that fundamentally affects acute frequencies. The current lifestyle means that this pathology currently appears from the age of 50. Its treatment will consist of avoiding risk factors and in order to improve hearing in the use of hearing aids. Selection of hearing aids. There are currently several types of hearing aids on the market. In addition, it is a sector in continuous progress that evolves at the same time that technology does. Therefore, it is essential to analyze well the needs and personal characteristics to choose the most suitable prosthesis, and this makes it essential the advice of expert personnel, in this case, the otolaryngologist and audiologist. When selecting the type of hearing aid, this must be taken into account, the severity of the loss. Not all hearing aids have the same ability to amplify sound. The otolaryngologist is the specialist who will know what types of hearing aids cover the hearing loss, and within these, we will be able to choose with the help of the audiologist. The functionality of the hearing aid. Each person has a different daily routine, so the requirements of the hearing aid are also different. You need to know what you want the hearing aids for, as there are features that are not applicable to all hearing aids. Dexterity in the handling of the hearing aid. Hearing aids are miniature devices and you have to have skills, even good eyesight, for their maintenance, care and fitting. The audiologist is the one who must take into account this point, since it is the one who teaches these skills. The economic expense. In general, they are high-cost devices, so different types of prostheses and hearing centers must be assessed according to the capabilities of each one. Aesthetics. It is important to choose the device that pleases the most within the possibilities, as it has to be used on a daily basis. Types of hearing aids. Conventional hearing aids, by ear. They are electronically very complex devices that help to perceive the sounds of the environment and speech, selectively amplifying each of the frequencies, without exceeding certain intensities to avoid discomfort, threshold of discomfort or pain, in people who suffer hearing loss. Basically, the sound is picked up by a microphone that converts sound waves into electrical signals. These pass to an amplifier, where the signal can be transformed and amplified adapting to the needs of each person, and from here to the receiver, which converts the electrical signals back into sound. Behind the ear, BTE, hearing aids. All electronic components are housed inside a housing that will rest on the ear. By the elbow at its end is attached to the mold, using a flexible plastic tube. They are the only ones suitable to cover hearing impairments from slight to deep, being necessary for these last ones, apparatuses of greater size. This is due to the necessity to incorporate a more powerful earpiece. The main advantages of this apparatus are its power, its easy manipulation and the possibility of adapting the FM, modulated frequency. It allows the direct transmission of the sound from a transmitter source, for example, a microphone. Its main disadvantage is that it is perhaps the least discreet. In the ear, ITE, hearing aids. These hearing aids are placed in the shell of the outer ear that extends into the ear canal. Most people are able to easily manipulate the volume control and batteries. They are easy to fit due to their size, but they are also visible. In the canal, ITC, hearing aids. This type is placed inside the auditory canal and is not very visible, enters the group of so-called invisible hearing aids. Because of its small size, both battery replacement and placement in the ear can be complicated tasks without good manual dexterity. Being smaller in size, they are less powerful, and because the circuits are miniaturized, they also tend to be more expensive. Cross and bi-cross hearing aids. These are hearing aids that are specifically used when hearing in one ear is much less than in the other or has a total loss. In this case, a microphone is placed in the most affected ear and held in place by a behind-the-ear device. The sound is transmitted to the hearing aid of the least affected ear via a cable behind the neck or a wireless system. The hearing aid of the least affected ear picks up the sounds from the microphone of the most affected ear and then transmits them to the hearing aid of the least affected ear. Bone conduction implants. These are hearing aids that work by directly stimulating the bone pathway. They capture sound through the air and convert it into vibration that stimulates either the temporal or the ossicles chain, carrying the sound directly to the inner ear. The placement of these implants involves a surgical intervention, so their indications are limited to cases in which a conventional hearing aid is not viable. For example, when the morphology of the auditory pavilion does not allow a hearing aid, or there is no auditory pavilion, or when the hearing aid generates repeated ear infections by not allowing ventilation, case of bad perforations. When to indicate a hearing aid. The diagnosis and treatment of hearing loss should be done as early as possible. The specialist in otolaryngology is responsible for diagnosis, prescribing treatment and monitoring. The treatment may be medical, surgical or audioprosthetic.